As I see the participants streaming in, let me at least start welcoming all those who have already joined in. We'll wait for a few more minutes, maybe a couple of minutes, till a few more join in, as I see the list of participants increasing. And we'll start very soon after a couple of minutes. Okay, it's 3 minutes past 7 p.m. And I think we will start off this webinar now. Let me extend a very warm welcome to all of you who are attending this 17th Consumer Pyramids Household Survey webinar series. This is a series where we help researchers who have used the CPHS data to conduct some research, to present their work over here, and invite a discussant to discuss the paper that has been written. This is usually a technical discussion, and all the people who participate over here do benefit from this discussion, which goes on for an hour and a half, and are free to participate in this by posting their questions on the chat box. And the authors will respond to that whenever they find the time to do that, either during the presentation or at the end of that. So let me start off by introducing the authors today of this very enticingly named paper, Inequality in India Declined During COVID. So the authors are Anup Malani. Anup has been almost a veteran now at CPHS webinars. This is going to be his third presentation. He made presentations in March and July of last year. In July, he presented a paper on excess mortality during COVID times. And now he's talking about inequality during COVID times. So Anup and his team are kind of veterans, well entrenched into the CPHS databases. They seem to be investing a lot, doing a lot of wonderful research. Anup is at the University of Chicago. He's the Lee and Brenna Freeman Professor of Law at the University of Chicago Law School. Is also a research associate at the National Bureau of Economic Research, the NBER. He has a very impressive long CV. I will not be reading that out over here. He has a PhD from the University of Chicago, and with him is his co-authors, Arpit Gupta, who is from the New York University Stern Business School. He is an assistant professor of finance over there, and there's Bartek Voda from University of Chicago Law School, again, is a research specialist over there. And with us, we have Neelanjan Sircar, who is a full-time senior fellow at CPR, the Center for Policy Research in Delhi. Neelanjan is a PhD from Columbia. is a political scientist. He has interests in urbanization and electoral behavior, and has recently published a book, Colossus, Anatomy of Delhi, with Sanjay Chakrabarti. So that is the distinguished panel I have over here with us. And I will not waste much time in taking away time from the authors and the discussant. Anup Malani's presentation will take about an hour, and then Neelanjan will have his discussions, which could last around 15 to 20 minutes. And feel free, all of you, to post your questions in the Q&A box. And as and when either Bartek or Arpit see that, they will respond to you in real time, or Anup and they can respond at the end of the presentation. After that, after Anup's presentation, Neelanjan will have 20 minutes for discuss, and then it's open to all if there's more time left. So with that, over to you, Anup, to tell us how inequality declined during COVID.
Okay, let me go ahead and share screen. Can everybody see my screen now? Okay, great. So first of all, to Mahesh and CMIE, thank you again for the opportunity to present. We look forward to comments from the audience and especially from Neelanjan. So let me go ahead and begin. As you mentioned, this is collaborative work with Arpit and Bartek, and one amongst a series of papers to help us understand the economic consequences of the pandemic, or at least economic dynamics that took place during the pandemic. And in this paper, our kind of provocative title or result is that inequality declined during the pandemic. I want to be very clear up front. We're going to talk about the decline during the pandemic. We are going to be very careful about asserting causation here, because that's very difficult to untangle. But let us begin. Okay, let me give you a little bit of the motivation for embarking on this research. Let me give you, for everybody in the audience, I'm guessing a lot of them are currently in India. And so this is going to be unsurprising. This is a little bit of the quick history of the pandemic, this particular pandemic in India. And you can see, given the data range that we're showing here, which is February 2020 to the end of 2021, you are seeing the first wave, so the original variant. Then you're seeing the Delta wave, and we haven't quite gotten to the Omicron wave here. So this is the first two waves in India. You've got daily deaths, daily cases. This is going to be unsurprising to people. The magnitude of this increase is also going to be unsurprising, although Omicron might put that to shame. This second figure gives, for the same range, two things. One is policy regimes. And stringency of lockdown. And then the second thing is that it gives mobility, which is a measure of human activity in response to the lockdown, perhaps, and perhaps even independent of the lockdown. And the key thing to note is that during the lockdown, which is indicated by this, the national lockdown, which is indicated by this shaded region here, and also here, you see the most stringent increase in restrictions on activities. Those are highest at the beginning of the lockdown, but even during the lockdown period, relax a bit, and then steadily decline, increasing occasionally when there is another wave, so during the Delta wave, but seeing steadily decline, steady declines since the peak. Mobility follows similar patterns. You see a big drop immediately, and then a steady increase, a drop again during Delta, and then a steady increase. Now, I want to point out two things before we move on. One is an interesting feature of the pandemic in India, also often in other countries, but particularly in India, is that the lockdown occurs when cases are particularly low. They do not occur when the cases are high, when the peaks occur. And that's an important thing to remember when we think about timing. The second thing to remember is keep an eye on not just the policy, but the mobility trends here. These are going to foretell dynamics that we see later on, which should be utterly unsurprising. Okay. Now, this is also a figure that's not going to surprise you, but now we're delving into the data a little bit, at least in the outcomes that we care about for this paper. So the first is poverty. It is not going to surprise you that poverty spiked during the lockdown and post-lockdown during the remainder of the pandemic that we cover here. So these are two different minimum wage thresholds, not actually implemented necessarily in practice, but the ILC threshold and the 7CPC threshold. And what you can see is you see big spikes in these thresholds during lockdown. Now, in each of these figures, you're going to see the date range here. You're going to see a first blue line, which is the date that we think the pandemic started, so February 2020. Then a month later, you're going to see the start of the lockdown, which is this gold-colored or yellow-colored line that's vertical. You'll see the lockdown indicated by that line and the end of it, which is this green line. Okay, and then after that is just the rest of the pandemic. This figure just happens to go to month 7 of 2021, although other figures will go a little bit further. And what you can see is a big spike, and a big decline afterwards, but it doesn't return, poverty doesn't return to pre-pandemic levels. Okay, so poverty spiked during the pandemic. This is true in urban areas, which is a pattern that we're going to see a lot in urban areas and rural areas. So this kind of figure is something that you should get used to seeing in the rest of the presentation. But you can see that there's kind of a big spike in poverty and a higher level of poverty even post lockdown. Okay, now what happened to inequality, which is the second outcome we look at? Well, let's look a little bit at what the literature says before we show you what this paper finds. So there are many people that have found the spike in poverty that we showed in the previous figure. There is the Bertrand et al. Series of papers that look at this. If you want to go outside of India, you can see in Miguel and Mubarak a nice review of the literature. I don't think there's any doubt that poverty rose dramatically during the lockdown, during the pandemic. The big question is whether inequality rose. I think a lot of people inferred that the poor were more hurt than the rich when they saw poverty rise. There's the Oxfam study that I think made waves. There's the Premji University extensive study that suggests the same. But that's not a consensus quite yet. There's even before this paper, you had Angus Deaton write a kind of a bold paper that's an NBR working paper that showed that inequality across countries, or suggests that inequality across countries might have actually improved, that is to say fallen, during the pandemic, in part because mortality was higher in higher GDP per capita countries. Okay, could have been because of age, could have been something else, but that was a salient fact, remains a salient fact, and he suggests that perhaps that means that inequality is going to decline. But there's not as much work done prior to this paper on inequality within countries, in part because I think it's very hard to find data sets like CMIE's CPHS data. There is one interesting paper that you ought to know about, which is a pre-pandemic paper, Scheidel in 2018, which actually argues that plagues historically have reduced inequality by disproportionately impacting the rich, which we thought was quite prescient as given this paper. And we're going to revisit that mechanism a little bit later. So now let's turn to our contribution. So we will argue that we use relatively high quality panel data to examine poverty and inequality, the mechanisms of those changes, and we're going to compare two time periods, lockdown and the remainder of the pandemic. We think that the dynamics are different across them. We'll also repeatedly show you urban and rural differences, although very often the patterns will be similar qualitatively, if not quantitatively. We think we contribute to about 3 literatures. One is the literature broadly on inequality in India. There's a long line of papers. I think a notable one is Banerjee and Piketty in 2005 on inequality in India. I think that there's some, we think that there's some recent changes in those dynamics, and we'll be writing more about that, I think, in the coming months and years. Second is the literature on poverty. During the pandemic, there is a large and growing number of papers documenting that occurs. I think that's hard to refute at this point. The third is a pre-pandemic literature on the sensitivity of income to business cycles across the income distribution. That is to say, when you have aggregate changes in aggregate income, some quartiles might be affected more than others, in particular the higher income quartiles might be, higher quartiles might be affected a little bit more. There's a literature, I think the leading one is Govaninen et al., but a series of papers that document this fact. So we'll be showing a little bit of that too. Okay, let me give you a quick preview of the results. I'm going to separate it into the lockdown period and the post-lockdown period. During the national lockdown, that shaded period in our figures, we're going to show the poverty and inequality spiked. I've already shown you a little bit on the poverty. I'll show you a little bit more, but it's both of them are going to have increased dramatically. Arguably wiping out gains that we've seen in the last few years, but it was a temporary thing. Post-lockdown, there was a reversion But even during the post-lockdown period, if compared to the pre-lockdown period, you'll see that poverty rose, though not as starkly as during the lockdown, but that income inequality fell. That's going to be a remarkable result. It was certainly not our prior going in. We are also going to show you that consumption inequality fell, although less. And the reason it fell less is because there was a lot of income smoothing both before the pandemic and during the pandemic. We're going to try to decompose the changes in inequality into social mobility and Gini. And we're going to show you that the Gini spiked during the lockdown, but held steady during the rest of the pandemic, steady at pre-pandemic levels. And in order to reconcile the result that income inequality fell and that Gini was steady post-lockdown, we're going to argue and demonstrate that there was really a jump in social mobility after the lockdown, and that explains why overall inequality may have declined during after the lockdown. We're going to give you evidence on two mechanisms we think are responsible. One is this idea from Scheidel to some extent and Gavanin et al. That business income of the rich is more susceptible to aggregate variation, including the massive negative shock to the Indian economy during the pandemic. And then the second one, which should also be intuitive, is that labor demand for the rich fell more than the poor because the rich are more concentrated in the service sector, which was hit harder during the pandemic. It is very important that we be clear that we do not show causation, certainly at the levels that you would expect in the current economic literature, with perhaps the exception of during the lockdown, where I think it's very hard to not think that there was a causal effect. But what we'll say is that we don't think we can show causation from the post-pandemic period to inequality. And the biggest evidence for this is that you will notice that inequality seemed to be declining in India even before the pandemic began. So to some extent, you can think of the post-pandemic period as perhaps a continuation of a pre-pandemic trend, raising the question of what caused that pre-pandemic trend. We're going to push that question off for future research. So now let me comment very briefly or somewhat briefly on data and methods, but happy to return to these questions. So obviously, we are presenting in this workshop because we're using the Consumer Pyramids household data. This is from CMIE. It's very important that we make clear that it's available to everybody for a subscription. It covers nearly all of India. There's some questions about Northeast, but it's fairly representative. In particular, it's representative at not just a national level, but down to a sub-state level, clusters of districts that are called homogeneous regions by CMIE. This is a very large panel data set, 197,000 households with 1.2 million members considered over time. Households typically are sampled every 4 months. There's reasonably good response rates, which we'll get back to in a second. Each month CMIE is continuing to sample. They sample a representative quarter of their national sample every month. And so when you're looking at national data, you can actually think of it, nationally representative data, you can actually look at this at a monthly level rather than just every 4 months. The data consider a broad range of outcomes, which I think is very valuable for understanding what happened during the pandemic. It measures income, both at the member and household level. It measures consumption at the household level, which then you can use various algorithms to allocate to individuals, but it does that for the last 4 months whenever there's a survey, so you're getting monthly data. Importantly, it measures the household roster, both new introductions because of birth, departures due to death, or migration, something that we've leveraged in prior papers, such as the paper with Sabarish Ramachandran on excess deaths. Measures wealth, employment, occupation, importantly, time use, which is going to be important for thinking about hours worked. Caste, it also measures. Those are measured every 4 months, but not necessarily asked about every prior month. So you're not getting monthly, but you're getting every 4 monthly data. Okay, I think this is a unique data set. I would actually argue that it's better than a lot of the data sets that we consider in the United States. So the panel survey of income dynamics, the survey of consumer finance, those are both smaller than these data here, the CPHS data. It's not a repeated cross-section, it's actually a true panel, CPHS is, so that's different than consumer expenditure survey or the current population survey. The survey of consumer finance is also a panel, but it's not as frequent as CPHS is. Unlike credit report data, which is hugely popular today, now these days in recent research, you're getting both the income side of households and the consumption side of households. So I think it's a fairly remarkable data set that I'm eager to see other people also explore to understand the Indian economy. But CPHS is not without issues. And I want to highlight two. We discussed many in the paper, but I want to highlight two. CPHS has a generally good response rate pre-pandemic, but during the lockdown in particular, for obvious reasons, response rates fell. Basically, from what we can understand, CPHS roughly sampled about half of households, and it did so not in person, but by phone. Which raises the question of whether or not the sample that it picked is representative. Response rates fell mechanically, and then some people might not have answered the phone. And you can see this dynamic here where we're plotting, for example, the response rate, which is the no failure rate, declines once the lockdown hits, stays low, recovers towards the end of round two in 2020, not the lockdown, when during this period, the survey is telephonic largely, is all telephonic, and then it returns back to in-person, except when local lockdowns make that infeasible. You see the decline again during the Delta wave. The question here for us is, when there's this decline, is this decline a non-representative decline in non-response? If it's random non-response, then it can be addressed with weights. And so that's the critical question for us. So response rates fell, but are they orthogonal to relevant covariates? Now, the way CPHS did it, as far as we understand it, is that they asked their local managers to pick phone numbers to call without regard to the covariates that are in CPHS, which is, good and helpful, but it's not the same thing as random. There wasn't a random algorithm, a computer code that's picking which phone numbers to call. So it requires us to check to see if, in fact, that was random. We conducted a fairly basic exercise, but that we think is quite telling. What we did is we tried to figure out what non-response was, tried to predict non-response based upon the covariates that are in CPHS. Now, there are a lot of covariates in CPHS. And so you have to, you can either run a very big regression, or you can use some sort of statistical learning methods to figure out what are the most predictive variables. So we did that. We did lasso of execution on all covariates, for example, and the R squared on that was remarkably low, suggesting that first, it's very hard to predict who does and who does not respond. But importantly, that means that even during non-response periods, things were very, it's very hard to predict who responded, i.e. It seems fairly random. So we are going to show you pre and post lockdown stuff. We're going to obviously focus on lockdown to some extent, and that's going to be during this non-response, but we think it's not unrepresentative. Okay, the second problem with CPHS, which is a problem that has to do with perhaps the way that CPHS's original sample is assembled, is that some people argue that CPHS does not represent the very poor. So Gendres and Somachi make this argument in a pair of op-eds, and then Somachi has a nice paper where he elaborates on this, comparing CPHS to other data sets, including government data sets. The core of the criticism comes down to, I think, two things. One is that the way that CPHS assembles its samples at the village level. And so it's weighting certain strata of, not village, towns equally. Whereas if you look at a lot of government data sets, they're trying to weight individuals equally as they pick their sample. Okay, that's one. The second one is there's a complaint that when CPHS goes to villages, CPHS samples from the main street, but not outskirts. Now, that's a factual question. Mahesh Vyas has contended that that's not actually true. And we're not gonna be able to quite answer that, but CPHS is currently trying to address this issue by going in its current round, if we understand correctly, and actually characterizing each household as Main Street or off Main Street. I think this is an unresolved question, but I don't think it affects substantially what you see in this paper. And let me give you two reasons why. The first one is that we are going to be CPHS. There's no allegation that it changes aside from this telephonic telephonic survey period during round 2 of 2020. There's no assertion that post-pandemic it's not doing post-lockdown. It wasn't doing what it was doing pre-lockdown in terms of sampling. That is to say, the sampling frame is constant. So as long as even if you think the sampling frame is incorrect or unrepresentative, as long as there's no change in it, you will be able to see time dynamics or dynamics over time for a consistent frame. So that's the first argument. That's a modest argument, but let me give you a better argument. We're going to show you that even if you take seriously the core criticism that Draz and Somanchi have, which is that there's an underrepresentation of the poor, that you're still probably going to get the same result, because the inequality results that we're going to show are going to have similar patterns at very low levels of the income distribution. And in fact, it'll be monotonic in the income distribution. So I'm going to get back to that, but that's going to be a critical reason why I think that what you see today is in some sense not orthogonal to, but unaffected by the Draz and Somanchi criticism. That said, I think it's important that that line of criticism be addressed systematically, and we've undertaken a research project to do that. Hopefully, we're hoping to collaborate actually with Anup Malani on that. But I think that we will be able to address some of these issues and validate or not validate them, and then address them by developing new weights. But today, I'm not going to be doing that. Okay, now a little bit more on the methods. That was on the data. This is the methods. So you're probably going to ask what the definition of various things we're going to show is. So let me go ahead and tell you a little bit about that. We're going to talk about per capita income, which we're going to define as member income plus household wage, household level income, divided by the number of household members. Now you're going to wonder, why is that? Well, this is, and particularly you're going to wonder because this makes it seem like, for example, that children in the household make the same amount as adults in the household. And that's true. That's what this definition does. But here's our goal. Our goal is not to assign household individuals within a household to different strata. We think that if there's a child of somebody in the third quartile, then the child and the adult of that household should be in the same quartile. So we want to make sure everybody in the household is assigned to the same quartile, and so that's why we defined the per capita income in this way. Everybody within the household is treated the same. For consumption, we do something very similar. Of course, CPHS doesn't give us individual consumption, so we're by necessity taking household consumption and just defining by household members. Again, for the same thing, to make sure that everybody's in the same consumption quartile. Now, there are other ways to do this. For example, the IMF allocation methods, which we use in a prior paper. We're not doing that here. Okay. For both income and consumption, we're going to show you figures that don't actually give the rupee level of income or consumption on a per capita basis. Instead, we're going to give you an index so that it's more easy to compare first, second, third, and fourth quartiles. They're all going to be at 100% or an index value of 100 in 2018. That is to say, we normalized by the 2018 average income. And so you can see everything relative to that. We're going to have to quantify what part of the income distribution or assign individuals to different parts of the income distribution, either at the percentile level or typically at the quartile level. And we're going to do that based upon average 2015 to 2019 income. Okay, so we're going to look at the pre-period and we're going to say, what was your income during that pre-period? And then what does that mean for what quartile would we assign you to? And when we define quartiles, you can define that at the national level or the state level. You can even do it at the sub-state level, like state by urban status level. For most of the default figures, we're going to do it at the state by urban level, but we're going to have robustness checks on almost all of these items and get similar patterns. As I told you, the pandemic is defined as starting in February 2020. The lockdown, and it continues till the last date that we're going to show you, which is typically July 2021. The lockdown is going to be defined as March to May 2020. Okay, now I'm going to tell you one last thing and belabor the methods a bit. You have to decide when you're plotting poverty, you're plotting inequality, you have to have a counterfactual, okay? And so this is how we construct the counterfactual. The first thing we do is we take the actual outcome that we observe, income or consumption, for a given individual at time t or month t. We subtract from it a baseline value, which I'm going to get to in just a second, and we regress that against indicators for what quartile you're in by month. okay? And we're going to be plotting quartile by month fixed effects in all our figures. So we're going to show you the actual coefficient values, but we're also going to show you standard errors, 95% confidence intervals. The real question is, how do we construct this baseline? And we typically consider 3 different baselines, and we're going to show you one mostly. One is just take the 2019 value of what the per capita what the individual's income was, and that's how we would conduct the value. Or another way to put this is, if you do it as 2018 value. Another way to put this is, assume that if you're measuring this in an index, that the counterfactual is that you're at an index value of 100 throughout. So it's all relative to that 2018 value. But you can be more sophisticated. You can construct a more complicated baseline, and we do by, say, we're in the pre-period, 2015 to 2019, regress outcomes against, for example, quartile indicators, indicators for a quartile by a time trend. So you have quartile-specific time trends. You can even add in month of year fixed effects, which capture seasonality, and you can net out seasonality too. And so you can define, for example, a baseline off of, you run this regression, you run a prediction model, and then you can generate a baseline of time trends by quartile, which is one thing that we do, or you can do time trends netting out seasonal effect by quartile, which is yet another baseline. And we'll show you get similar results either way. But this is the construct that you're going to see repeatedly. So now let's turn to the results. First, let's look at poverty. I've already shown you one figure. I'm going to show you a different one. The first figure looked at minimum wages defined by Indian entities. Here's poverty plotted for international benchmarks, specifically World Bank thresholds for extreme poverty, which is $1.90 a day. And you can do this both for the World Bank threshold applied to income or the World Bank threshold applied to consumption. And what you see is, again, this big jump in urban and rural areas during the lockdown, and then return to lower values, but not as low as the pre-pandemic period. Now, for those of you that are wondering, just in case some of you are interested in what the mean values of income and consumption were, you see these in the orange and copper lines in both these figures, but we're focusing on the dashed figures or dashed lines that have your confidence intervals around them. Okay, so poverty rose. I don't think that's very contentious. So let me turn quickly to income inequality, which I think is the more interesting result. This is going to be, I think, the most important figure in the paper and today. So as I said, what we find, surprisingly to us, and I think probably to many people, is that income inequality fell except during the lockdown. And let me discuss this figure. So this figure shows you what happened starting in 2018, going all the way to July 2021. It is going to cover, therefore, 2 waves as well as the lockdown. You're going to see the index value for each of the quartiles. You're going to have 4 quartiles, where 4th is the top quartile. That's in fuchsia. The copper line is for the lowest quartile. We're going to be focusing a lot on 1-4 throughout this pandemic, throughout this presentation, to measure inequality. So pay attention to those. You're going to see that it's about 100 in 2018 and then begins to deviate. This is what happens when the lockdown starts. This is when the pandemic starts, sorry. Then the lockdown starts, lockdown ends, and then it continues to July. Okay, you'll see the mean values, which are really the coefficients on that regression I told you by month. You're going to see mean values for each quartile over time. But then to help you interpret this, we're going to plot the difference between the first quartile and the 4th quartile. That is to say, first quartile index value minus 4th quartile index value as a green dashed line. And we're going to give you the standard error, the 95% confidence interval. Well, that's the shaded region. Okay. So when you interpret this, remember it's 1-4, not 4-1. So that means as you increase the income of the poor, you're decreasing inequality. So higher values means less inequality. Okay. Higher values means less inequality. So what do you see? Well, overall, you should see that, in fact, inequality increased during the lockdown, and then continued to fall or fell during the post-lockdown period. But there's a lot of nuance here I think I want to stress. The first, as I want to point out, is that there was a pre-trend. Inequality starts declining prior to the pandemic. In urban areas, it's as early as the third quarter of 2018, seems to start a little bit later in the middle of 2019 for rural areas, but it starts before the pandemic actually starts. Second, that pre-trend might cause you to wonder about causation. And I think that's fair. It causes us to wonder about causation too. We are working on trying to figure out if there's different dynamics going on in terms of mechanisms post, kind of in this period of the pandemic versus before the pandemic. We haven't finished that analysis, but it should cause you to at least wonder a little bit about the causation. That said, it seems that lockdown is a pretty clear break, a pretty clear trend break, giving at least us some confidence that this is probably more likely to be causal, the decline during the lockdown. Now, notice that the lockdown is a little bit less severe in rural areas, okay? The third thing that I want to point out is that the poor, after the lockdown, seem to return to at least their pre-pandemic levels of income, if not in trends, whereas that's certainly not the case for the rich, which is consistent with this idea that inequality keeps declining post the lockdown, okay? And you'll see that in both regions, but it'll be a little bit more volatile in the rural areas. Now in rural areas, I want to point out something. You'll see a lot of these fluctuations, unsurprising to you, those are seasons. You will see that if we compare lockdown during in urban areas versus rural areas, it seems that the rich suffer the same as the poor in urban areas, but rich suffer more than the poor in rural areas during the lockdown. You can see that. And so these are just kind of small details. We're not going to show you today, probably because of time, but that you can do other cuts of the data. For example, you can say, hey, is this a caste issue? Is there a regional gradient on this? And the short answer to that is, look, there's not as much cross-caste differences. A lot of these inequalities that you see are even within castes. And so you see decline of inequality within each broad caste category that you see labeled in the CPHS. But if you cut the data via region, you again see differences within, but you also see differences across regions. Some regions are affected more than others during the pandemic, at least with respect to inequality. Again, we have some slides on this, but let's postpone those just in case we have time. All right. I wanted to mention also this inequality result is robust. This is not a feature of just having drawn it this particular way in this particular slide. You can, for example, try different baselines. You can do a linear trend baseline, or you can do a baseline that takes out seasons, and you will get similar dynamics. Inequality follows the same pattern as if you just benchmark people to being at the same level they were in 2018 on average. You could try other types of checks. So you can try different weighting schemes, or you can define quartiles not at the state by urban status level, but at the, say, the national level. You can do that and you'll get similar dynamics. This is the 1-4 figure for urban and rural. The dark black is our benchmark one that we showed you in the previous slide. The gray ones are just different variations on weighting or definitions of quartiles. And you see, again, similar dynamics as in the last thing. In fact, you might wonder, well, what about if you did more to deal with non-response? For example, you might say with non-response, I want to only include people that responded during the entire sample, like only the folks that were responders even during the severest part of the lockdown. Similar dynamics. You might say, well, I actually want to reweight people to address this issue. I want to predict whether or not they're going to respond during that round 2 of 2020. Use those predictions about probability response to reweight the data. So people that are less likely to respond are weighted a little bit more. So inverse probability weights, same results. You might say, okay, I don't want to define quartiles just based upon the pre-pandemic period. I want to define quartiles based upon the entire 2015 to the July 2021 period, maybe by excluding a particular month that you're actually assigning people to quartiles in. Do that, and you'll get very similar results. So I don't think that this is a feature of the way that we choose to do our default depictions. Now, here's another really profound result, which partly begins to address the Drej and Somanchi concern about representativeness. The decline in inequality, income inequality, is nearly monotonic. And what do I mean by that? I mean that the effect of the pandemic, particularly in the post-pandemic period, the effect of post-lockdown period, the effect of the pandemic is smaller, the smaller your the lower your income percentile. So the people that are affected the least are the lowest income percentiles. The people affected the most are the highest income percentiles. This figure shows that by showing you two things. First is it plots the 2019 mean income, which is in red, and then the 2020 mean income for each percentile, for urban and for rural again. In addition, it's also showing you the index value of where you are on average in 2021 relative to 100, in 2020 relative to 100. And you'll see that the people that are the poorest are affected the least, and the people that are the richest are affected the most. Why is that relevant to Somanchi? Somanchi's criticism is, Dresden Somanchi's criticism is underrepresentation of the poor. That can be translated as almost isomorphic with the idea that what we define as the 25th percentile is actually too high. In fact, you have to go down to something like the 10th or 5th or 1st percentile, and that's close to the 25th percentile because we're undersampling those guys. So you could just decide, I'm going to replace the 25th percentile with something, a lower percentile. You'd get the same answer. In fact, you might see even bigger declines in inequality as a result of that. By the way, you're going to see this again for consumption. It's monotonic for consumption as well. So let's turn to consumption. Similar pattern. Now, few things that are different. I think the most notable one that I want to stress is that the decline in inequality that you see during the pandemic, post-lockdown during the pandemic, is less severe than in income. So here you're going to 40, 0 to 40, whereas before the decline was closer to 40 to 60 for income. All right. So other than that, though, very similar dynamics. A second issue that might be different is that the drop during the lockdown is not as severe, which is kind of interesting, and actually to me a hopeful result, a positive result. But those are the two things that I think that you want to stress. Now, why is it that the effects on income were much bigger than the effects on consumption? And I think the answer is consumption smoothing. There is substantial amounts of consumption smoothing in India that goes on, and that happened before the pandemic. It happened during the pandemic, and it did not change with respect to folks in the first quartile versus those in the fourth quartile. So let me illustrate this. So there's a standard test of consumption smoothing. It goes back to Cochrane, John Cochrane's work, or Bob Townsend's work in 1994. And what you do is you regress consumption of a household against the income of the household, and you check to see what that coefficient is. And that coefficient is your marginal propensity to consume increase each dollar or each rupee increase in income. And if that coefficient is very low, you're smoothing. If that that coefficient is high, you're not smoothing. Okay. Now, what we add is a few wrinkles to this. One wrinkle to this is we say, what is the degree of consumption smoothing both before the pandemic and then during the pandemic? We do that with a pandemic interaction. And the second thing we do is we say, let's add in some aggregate consumption effects to see how much aggregate volatility there is. So what I would start you out with is this column right here, which tells you that pre-pandemic, there was a considerable amount of consumption smoothing. Roughly your marginal propensity to consume was around 13%, which is actually close to what you saw in Townsend in 1994. What's really interesting about this is that if you look what happens during the pandemic, if anything, there's even more consumption smoothing the pandemic because it lowers your coefficient. Okay. Now, if you add in the possibility of aggregate shocks, which we do in column 1, you're getting even more consumption smoothing. It's just less of it for, because you get this aggregate shock. And again, you're not seeing a big difference during the pandemic. Overall, what we take away from this is the marginal propensity to consume is about 10%. It's lower than we thought before. But what's most interesting, and lower than Townsend 1994, to be clear, but of course we're running this regression nearly 25 years later. Hopefully there's some improvements in credit marks, but the important thing is that there's no decline in the marginal propensity to consume, no decline in your ability, no decline in your ability to consumption smooth during the pandemic. So that's the first thing to think about. Consumption smoothing wasn't harmed during the pandemic for very substantially. Now you might wonder, wait a second, maybe it didn't decline for the rich, but maybe it declined a lot for the poor. So the poor were unable to consumption smooth. So one way to check that is to interact your income variable with quartile status. And what you find is, even in the pre-pandemic period, while the marginal propensity to consume overall was around 13%, there's not a lot of differences across the different quartiles. And the same story repeats itself during the pandemic. There's not a lot of difference across quartiles in your ability to consumption smooth. That was, again, surprising to us. It's actually contrary to prior literature. So Morduk in 1999 suggests there is differences in propensity to your marginal propensity to consumer, your ability to consumption smooth across quartiles. We're not seeing that in the CPHS data. In fact, we did this not just for overall consumption, but we've done the same analysis for just food consumption, which is something that people were particularly worried about during the pandemic. And we get similar results when you look at food expenditure. Marginal propensity to consume is low. It stays low during the pandemic. There's not differences across quartiles. And that's a positive result, and though unexpected. Now, I just want to add in one thing. It's not just in consumption that we see this. In fact, if you go back to Malani and Ramachandran, the paper that I wrote with Sabarish last year on excess mortality, we looked at that gradient across income levels, because again, we're using CPHS to do this. It's another benefit of using this particular data set. And what we find, surprisingly, is that in fact there was I don't know if it's good to call this progressive, but there's a progressive gradient to the income, to the excess mortality. That is to say, pre-pandemic, the rich died at a lower rate, had a lower mortality rate than the poor. During the pandemic, that flipped, so that the wealthy, the rich, the highest quartiles, or in this case, we're showing terciles, actually had higher excess mortality rates than the poor. So much so that if you just look across terciles, summing up both the baseline and what's happening during the pandemic, the mortality rates shockingly are the same across all terciles after, like, if you look at the latest dates in CPHS. And that's because the progressive gradient on the pandemic excess deaths flattens out the mortality rate, which prior to the pandemic disfavored the poor. All right, so now let's turn to some decompositions and then mechanisms. First decomposition I want to show you is Gini. Very common way to measure inequality. It is the fraction of income that is attributed to different percentiles of the income distribution. And what you can see here is that Gini spiked, whether you look at urban and rural areas for income. It spiked during the lockdown, but then post-lockdown seems to have largely returned to pre-pandemic levels of Gini. Maybe a little bit lower in urban areas, a little bit higher in urban areas, but pretty flat, I would say. You get something a little bit different for consumption. That's actually systematically declining. So it's a little bit more consistent with our overall picture. But at least for the income side, which is where our focus is in this paper a lot more, it seems like Gini doesn't budge in the same way that inequality overall budges or moves during the pandemic. So we need to explain that. And so here's our explanation. If you think about income, you can redefine income as the following for an individual. And income is roughly the same as the percentile that you're in and the income of the percentile that you're in. Okay, so you assign me to, let's say, the 70th percentile, and then my income would really be the income of the 70th percentile. Now, if you do it that way, you can see that changes in income, which is what we're looking at, just by using the chain rule, should look like something like the following. A change in income is the change in your percentile holding your income for that percentile constant, plus the change in the income of a percentile holding the percentile constant. Now, translating that to English, that's saying the total changes in income that we're showing can be decomposed into social mobility, which is the change in your percentile holding the income of the percentile constant, or Gini, which is the percentile of income possessed, or the amount of income possessed by each percentile. Okay, what I showed you before in the last slide was Gini. Now I want to show you social mobility. In order to reconcile our top line results with Gini being largely flat, it would have to be the case that social mobility increased. And in fact, that's what we find. And we're going to show you this in two ways. First is, this is just a time trend plot of people switching out of their quartiles during different months. The key thing I want to focus on is I want to focus on the top percent, the lowest quartile and the top quartile, because when there's a jump in mobility for the top quartile, it has to be down. That's the only way you can go. If there's a jump in mobility for the lowest quartile, it has to be up, because that's the only way that you can go. And what you see is for both of those, you see a big jump in switching quartiles during the pandemic, okay? That's your first hint that there's a lot of social mobility going on. The other thing you can do is you can plot month by month changes in quartiles and come up with a transition matrix. What is the probability that each quartile will be in a different quartile in every month? And then what you can do is you can do one thing further. You can say, all right, there's that sort of kind of social mobility that you saw pre-pandemic. How does it differ when you see it during the pandemic, say post-lockdown? And so you can take the difference across those two transition matrices. By the way, those transition matrices are called the Shocks index, and you can see what happens. Here we've done that. That's that difference in difference. You see that there's mobility in the sense that you're moving out of your quartile. This is your starting quartile, ending quartile, but the difference across years. What you're really interested in seeing is there movement up from the bottom quartile, and is there movement down from the top quartile? And you do see that. You see for the top two quartiles, you see more movement down, and for the bottom two quartiles, you see more movement up in terms of shade of movement, red being higher. Okay, so again, it seems that what's going on is that there's greater social mobility going on in the pandemic, and that explains the top line results and why Gini does not budge as much. Now let's look at mechanisms. I want to keep track of time. We're going to investigate 4 different mechanisms for why it is that we see the inequality patterns, in particular income inequality patterns that we see. Government transfers, we're going to look at your business income, we're going to then look at your labor income, both the supply side and the demand side. So the first result I want to stress is we don't think that the decline in inequality, income inequality, is due to government transfers. So here what we've got is a plot of government transfers for urban and rural areas. There is an increase, but this is again in INR values. So these are not massive increases on an individual level. Now, what's a better measure is what if we took government transfers out of income and then plotted income? What would happen to inequality? And the inequality patterns look similar. So even when you net out you're seeing that inequality declines. And this is why we think the overall inequality result is not due to government transfers. Now, you might get a different answer in the United States. So my colleague Bruce Meyer at the University of Chicago has a nice paper that shows that in fact the government transfers that spiked during the pandemic in the US substantially mitigated poverty, but also may have mitigated the trend, kind of increase in or stopped an increase in inequality during the pandemic. I don't think that's really the story in India. A second argument or second consideration is to look at capital income or business income. So I want to do this in 2 slides. The first thing I want to do is give you a frame to think about business income. I want to, for at least the first quartile and the fourth quartile, which are the kind of extremes of the distribution, as we partitioned it, I want to show you decomposition of income into different types of income. So for example, for the first quartile by month, we're going to show you the fraction of income that's due to wages, to business profits, which is blue, to pensions, capital income, which is different than ownership of your own business and profits. This is, for example, passive investment. And then other things, which includes, among other things, would include, for example, government transfers, but a lot else. So government transfers aren't necessarily always the full bulk of that. The first thing I want to point out to you is wages are important to both, a little bit less important to the fourth quartile than the first quartile, but importantly, if we turn to business income, you'll see that business income is a higher percentage of the overall income of the fourth quartile relative to the first quartile. This is the reason why you might want to compare business income and labor income and see what's going on. Okay. Now, I want to show you that the business income period is more vulnerable to aggregate shocks to the economy, like you saw the big aggregate negative shock to the economy during the pandemic. The business income is more susceptible to that, because the income of the fourth quartile is more reliant on business income. That may be one reason they were affected more negatively by the pandemic than the poor. And I'm going to show you the opposite roughly for labor. The way that I'm going to show you is I'm going to use a regression model that you can get from Govaninen that is showing you how individual income responds to aggregate shocks. This is going to be a fairly intuitive regression. We're going to take the log of income for a particular type of income, let's say capital income or business income, for a quartile, and subtract that current period from prior period. And then we're going to regress that against aggregate income, including all portions, labor, capital, business, all in. But we're going to look at the aggregate level, and we're going to take that difference and say how much is the individual change correlated with the aggregate. We'll also have a fixed effect, and we'll partition this by quartile. So we'll have an interaction with quartile. So let's suppose you do that where the left-hand side, you're looking at business income. What do things look like? What you see is that the lowest quartile has the least sensitivity. So what I'm plotting for you now is the beta from this regression for the lowest quartile. The correlation is low. If you go to the fourth quartile, the correlation with aggregate income is very high. Now the standard errors overlap, so these are not a statistically significant result, but the means show you that the wealthy, the higher quartiles, their business income is more susceptible to aggregate shocks. If you did that for labor, you don't see much difference in the means. And so the story that you're getting, not statistically significant, but the story that you're getting is, look, maybe part of this is higher quartiles rely on business income, and business income is hurt more by aggregate shocks. Pandemic was an aggregate shock. Hence, we can conclude that maybe one mechanism for what we see, the decline in inequality, is the susceptibility of the rich to aggregate shocks due to business income. Okay, that was one possible mechanism. I think that's plausible. Let's turn to the next, which is labor. And on labor, I want to consider labor supply and labor demand. So labor supply, how do you measure this? I'm going to do this fairly quickly. We will estimate a Roy model with two sectors, employed and not employed. We're going to use a technique that's summarized in French in Tabor 2021, which typically involves a wage regression that we then instrument for sector on. So your wage regression is your wage regressed on factors in addition to whether or not you just arrived in a particular sector, which is employed or unemployed. The controls are include demographics, education, location, and obviously the switch indicator. But the key thing is the way that we identify the determinants of wage is going to, from a particular sector, is going to be whether or not you actually switched just recently. And that's going to be exclusion restriction. So we're going to estimate the wage equation. Then we're going to be able to estimate what the predicted reservation wage is by saying, look, if you were in the non-employed sector, what would be your wage? This is the equation that we're going to get from that. And then here's going to be our test. We're going to, for each individual, based upon their specific covariates, we're going to estimate what their reservation wage is. Then we can categorize people into their quartiles, and we're going to say, how does the reservation wage, predicted reservation wage for each person to enter into employment, how does that vary with whether or not they're above or below median income? Okay. Now, if you do that, so you're basically saying, look, I'm going to try to see whether or not the reservation wages of the rich behave differently than the reservation wages of the poor, both before the pandemic and during the pandemic. Well, if you do that, you get a result as illustrated in column 5. And what's surprising about this result is not the first thing. That is to say, during the pandemic, well, maybe this is surprising. During the pandemic, because of the economic situation in India, people actually lowered their reservation wage. They were more willing to actually supply labor than before. Now, that might be a little bit surprising. You might think people are less willing to work because they're worried about getting infected. In India, the evidence doesn't suggest that. In fact, it suggests that the labor supply curve moved out. An interesting question is, did that happen more or less for the rich? The thing that is particularly surprising for us is, in fact, the rich were even more willing to supply than the poor during the pandemic. And you're going to see this on the labor demand side a little bit too. But the interesting thing about this suggests that if the rich were hurt more during the pandemic, it wasn't because they contracted their labor supply more. If anything, they increased their labor supply. Now let's turn then to labor demand, the last possible explanation. I'm going to give you indirect evidence. I'm going to give you direct evidence. The indirect evidence just looks at equilibrium quantities. So you can look at the quantity of employment, you can look at the quantity of hours, and you can look at wages during the pandemic and see what happened. And I want you to focus on the post-lockdown period. So don't focus on the big spike, focus on the post-lockdown period. What you see is on quantity, the rich actually have less quantity post-lockdown. No difference in hours, and you see the rich have lower wages during the post-lockdown period. Now, remember, wages come from taking employment, dividing by taking income and dividing by hours. So it's a derivative of hours. Okay. So the rich have lower quantity and lower prices. Now, if this was a supply effect, okay, that in fact supply contracted, you would see lower quantity, but you'd see higher wages, not lower wages. Instead, you're seeing lower wages. That can only be expected by, or that's consistent with the demand side explanation. That's indirect because I'm doing that through equilibrium quantities. Let me do it more directly. So what we do in this exercise is we categorize sectors and consumption into 3 bins: services, agriculture, and manufacturing. And here we're showing you that 4 different quartiles. So first quartile, second quartile, third, fourth quartile for each round of CPHS, what fraction of work is in each of the sectors. So this is labor supply. And what you see is the rich throughout seem to supply more in services than the poor do. Okay, that continues throughout the pandemic. Agriculture has slightly different has similar patterns. Manufacturing has the opposite patterns, but services is what I want you to focus on. So this is the production side. Now look at the consumption side. If you look at consumption expenditures across India, what consumption expenditures fall the most? It's services. This is consistent across the world. Services require human contact, more risk of actually getting a pandemic or getting infected, and so that falls the most. Now you put these 2 together, you see the rich are most concentrated in services, and the poor and consumption falls the most in services, suggesting the demand for the labor that the rich supply actually contracts the most. Okay, let me end with some discussion. You might want to try to compare what we find, the decline in inequality during the pandemic, with what happens during demonetization. You can do that with CPHS. It's a comparison of shocks. What's really interesting, I think, is really that inequality contracted during the pandemic, but you don't see the exact same thing during demonetization. There's something different about what the dynamics were during the pandemic. You can also contrast the United States. I'm not going to do that given time. But I also want to end with these limitations, which I think Neelanjan is going to comment a little bit more on. But we don't really show causation. You might be more persuaded during the lockdown, but I don't think we really show it persuasively. I think that it's important to continue research and compare CPHS to other government data sets, kind of like Gendres and Samachi recommend. We don't predict that it'll make much of a difference given what the arguments that we made before about lower quartile effects or lower percentile effects. You cannot, for example, if you're interested in the Piketty type questions about the top quartiles, which unfortunately many of us are because we all hang out in cities and see these top quartiles. I wouldn't recommend normally doing that, but many people do. But we can't answer that question with CPHS because we don't have the very highest quartiles. And another last important limitation I think is we don't tell you how important labor demand is vis-a, say, business income. They're both relevant, but we haven't quantified the relative contributions. Let me end with that.
Thank you, Anup. That was a fascinating presentation with lots of findings over there. I won't take up any time over here. In the interest of time as well, I'll hand over to Neelanjan. Neelanjan Sircar, over to you.
Thank you. Can you hear me clearly?
Yes.
Okay, great. Let me just quickly get this going. Oh, what's happening now? Screen first. So as I get this going, let me just a word of caution. You were already warned. I'm not an economist. I'm a political scientist. So I will do my best, obviously, to interact in this very, very rich paper. It's really an honor to comment on this. I've been following Anup's work from the very beginning on the pandemic, and we've cooperated on a few things as well. So it's nice to sort of be able to comment on something from scratch. So just a bit of recap, because a lot of you have not read the paper. There was a lot to take in. I am obviously skimming off points here, but just a couple of main points that we would have seen from this presentation. So post-lockdown, right? We see in the post-lockdown period that income shares, and to a lesser extent, consumption shares for the top quartile, drop relative to the bottom quartile in the post-lockdown period. So part of our challenge here will be to interpret exactly what it is that we've seen and what we can attribute it to. Now, I think there were a number of robustness checks that were made available during the talk. I want to sort of just talk about two, which I think get at the core of the mechanism. You might believe that declining inequality is that rich people looking at how bad things are in the lockdown, how bad things are likely to be in the lockdown, say, okay, you know what? No point in trying to enter the job market now. I can bear it, I'm rich. So the labor supply is going to shrink. I think we have some convincing evidence based on the CPHS data that that's not what happened. That was done by estimating reservation wages, and somewhat surprisingly, in fact, the highest quartiles have a greater drop in reservation wage. So it doesn't look like contraction of labor supply. The story seems to be pinned on differential labor demand. This is shown in a few different ways, but broadly, the sectors that employ the highest quartiles, namely services, saw the steepest decline in labor market demand. And so we are sort of guessing that that might be what has explained the larger decrease in incomes for the top quartile vis-a-vis the bottom quartile. Okay. So just a couple of small interrogations. I don't know that I'm going to go 15, 20 minutes here, but let's just sort of see where these comments take us. So as Anup mentioned, there were three versions of this graph. One of these versions is the key graph in the paper. So we'll see if I can blow this up a little bit for all of you. Okay. And what I wanted to do was, in some sense, the paper is, rises and falls on this graph, and what we can discern from this graph, and what we believe and what we don't believe based on this graph. So the interpretation that we were given is that, taking baseline levels, we have a certain measure of income inequality, which is the first minus the fourth quartile incomes. And you can see that as things go up, inequality is decreasing. There's a funny thing here that happens actually that just before the pandemic period starts as a bit of a blip, but leaving that aside, there's a steep increase in inequality during the lockdown period, but it rebounds quite significantly. And then we again sort of see that inequality continues to decrease. So first, just some very, very basic questions here. One is based on what's been presented here and the fact that these are 95% confidence intervals, just some clarity on when the difference is becoming significant vis-a-vis, and it's clearly becoming significant somewhere, right? Because I can just sort of eyeball that, but just sort of getting some clarity on what's happening there. A small point that I made actually as you were giving the talk, it just sort of occurred to me, just a small check based on what your income definition is doing, because you're dividing by the number of household members. And so you can imagine that just simply because you're explicitly making a claim about volatility and variation, that volatility will be lower in larger households. So if larger households are associated with lower quartiles, then just making sure, just putting in a quick check there to make sure that's not happening. Okay, so, two or three questions that I really wanted to ask on this graph. So the first is, in a paper that is asking whether inequality declined during the period of COVID, non-causal, what should we demand from a graph like this, right? So here are two possible interpretations. One is that there's some trend before COVID hits in earnest and the lockdown hits in earnest, vis-a-vis income inequality. Lockdown hits. Should we expect a structural break in how income inequality evolves after that, right? So clearly it will still not be causal, right? Because at this point, the labor market can reorganize itself in non-exogenous ways, right? So no, there's no claim of causality. But when we want to say that something has happened post-lockdown or during the COVID period, should we demand that there is actually some kind of structural break? Now, what I would say looking at this graph is it's clear to me that over this period, income inequality has decreased. It's not clear to me that there's been a structural break pre-lockdown versus post-lockdown, right? And that's even more clear when let's quickly just get out of this. That's even more clear kind of when you do this weighting scheme where it almost looks like you could draw a straight line here, right? There's this dip, but then otherwise it almost looks like we could be drawing straight lines here, right? So just sort of thinking a little bit or making clear to us what we should be demanding from a graph like this if we are to say that there's been a decrease in income inequality during COVID. Now, the second point, maybe this is a bit of a nitpicky point. I just want to get a sense of how you're thinking about this. So you did mention that over this period, poverty increases, and even after the lockdown, rates of poverty have not rebounded to pre-pandemic levels. Now, let's look at the top quartile here. And it looks like their income is dropping to around 50% of the baseline, right? Between 40, 50, 60%. Do we believe that the bottom quartile has that much room to drop, right? In some sense, would you still be alive if you're dropping, 50% if you're the bottom quartile, right? So are there structural effects of poverty that change how much your income can grow or drop, right? And so sort of thinking a little bit about what that might do to our measure, right? So in other words, mechanically, in the context of a large income shock, if it's so large on the poor, they'll disappear because they can't subsist. Are we sort of mechanically in a world where income inequality has to decrease just simply because the poor can't bear such a large shock? And the third, and you sort of mentioned it briefly, is there's some rural-urban story going on here, that the effects seem less severe in rural areas as opposed to urban areas. And we had a lot of popular media in India commenting on this phenomenon. People went back to their villages, got engaged in agriculture if they had land, and perhaps that was some way of mitigating the income shock that existed in urban areas. So if you were able to go back, or if your family was able to be engaged in rural areas, that's something that happened. Now, I had a bit of a challenge here in the paper. I couldn't see how you define rural and urban. My sense is it's coming from Census 2011, which is part of the CPHS. That's how the sampling frame was done. But rural does not equal agriculture, right, in India. And rural in 2011 certainly doesn't equal agriculture today, right? And that date, you have the data in the CPHS to sort of disentangle a bit further as to what is in your rural sample and what is in your urban sample. Let me give you a quick sense of the way that I think about this. So this is some of my own work. Sorry for the quick and dirty graphs. Where what we're doing is we're looking at female labor force participation, actually. And we have rural areas and urban areas, census defined, and we're taking an asset index from poorest to richest. Now, Dhanbad, leave Dhanbad out, it's an industrial area. Typically, what you're going to see is when there's a large amount of agriculture, there's a urban-rural employment gap. And we tend to think that this is basically an agricultural labor gap, right? And you can see that as people get wealthier in agricultural areas, broadly, female labor force participation converges, people opt out of agricultural labor, things don't look dramatically different, right? So there's at the lower end of the income distribution, there's a difference between rural and urban labor and the structure of rural and urban labor, not at the higher end of the distribution. Now, going back to this story, I think what would be important for us to understand in terms of what's happening in these quartiles is who are these people. So I can imagine a story in which if I'm engaged in agricultural labor or subsistence labor, subsistence agriculture, I may not see huge differences. If I am engaged in agriculture in a way that should be engaging markets more generally and making large profits, especially export, then I'm taking a big hit, right? So I think just trying to understand, I mean, there's no deep insight here in terms of you should do this or shouldn't do this, just trying to figure out what this is, right? And trying to break out the labor market structure. I think would be helpful. Okay, so see if I've got maybe about 3 or 4 minutes. So just a couple of points. Now, this is also, you know, a bit nitpicky, perhaps, but you know, one of the things that I'm intrigued by is when you talk about the different sectors, right? You ended your talk on this, and this is a fascinating argument, right? The idea that really what's causing this is the fact that there is differential labor demand across where the wealthiest population is engaged and where the less wealthy population engaged. Another way to look at it though, and so one thing that's tricky here is that these are standardized, so I'd like to kind of see them unstandardized to understand what's happening here a little bit. So one way to sort of think about this is that people who have certain kinds of risk preferences, you might be wealthier or you may just be more risk loving. You might be willing to engage in a market that has higher incomes, but more volatile incomes, or you may even be unemployed for large periods of time, right? Like our friends who work in hedge funds or work in .coms, you'll see some that work nearly 4 months a year, make a lot of money, and then are unemployed for like many months and then back to it, right? That's the thing that we see. So, you know, one of the things that, the reason why it matters for thinking a little bit about what this story is that, you know, yes, back to your original graph, yes, the wealthy in urban areas in particular have been hit quite badly, but it still may not be a bad bet if I have certain kinds of risk preferences and I have certain beliefs about the volatility of the market in services vis-a-vis agriculture, for instance, right? And at least initially, this yellow does look a bit more volatile, right? I mean, certainly here, right? So just sort of thinking a little bit about how risk preferences might play into the kind of story that's here. And I think the way to do it would be just to sort of tease out in an unstandardized way what's happening with labor in what's happening to wages in each of these sectors. I'll leave the second point out. I don't think it's that important. So final thing, right? I think given the framing of the paper, given this question that I've sort of asked about trends, and given sort of the idea that, you know, we know that wealthy and poor are sorting and selecting into different sectors. There's a question about whether, you know, how to frame whether the lockdown mattered at all, right? So you can imagine that another way of framing this would be the null hypothesis, the lockdown should have increased income inequality. And that's something that you can pretty conclusively reject based on the stuff that you have in this paper, right? On the other hand, if the kind of claim we're trying to make is that the lockdown or the pandemic period structurally changed the way that income inequality happens, not necessarily causal, right? As I said, people can be strategic once the pandemic hits. That's maybe less clear in terms of the evidence that's here, right? And so trying to sort of be a little more precise, I think, about what you think the lockdown is doing vis-a-vis income inequality and what would be the equivalent structural shape that you would expect from graphs like this, based on the hypothesis that you have. So I'll leave it there. I thought it was a wonderful paper. I mean, obviously, very counterintuitive. I learned a lot. I'm not an economist, so I learned a lot about just CPHS, but also how to work with this kind of data vis-a-vis the pandemic. And I look forward to your comments. I look forward to seeing how this paper develops. So thank you.
Thank you, Neelanjan. Anup, would you like to respond to him?
Yeah, thank you. First of all, thank you, Neelanjan, for those comments. And before I begin, let me just say we've had a chance to work with Neelanjan during the pandemic. I think lots of us probably on this call have done different efforts during the pandemic to help the government contain its effect. Neelanjan is no exception. He worked in several states. We did as well. But one of the kind of the positive points of this is our ability to work together and use our data skills for good use, whether it's doing serological surveys or helping government set up testing programs. It has been, in otherwise a very trying time, a positive moment. And so I really appreciated that. People should appreciate Neelanjan for his efforts. But I also want to thank him for his comments on this paper. This is really helpful. I took away a bunch of comments. I'm not going to respond to all of them. I just want to respond to a few that I think are salient and that we have something constructive in the short run to say. So I think Neelanjan's right. We do not demonstrate causation. Maybe you're more persuaded during lockdown. That trend line looked like it started before. The question is, what would you do to demonstrate causation to the extent that there is any? And he asks, is a structural break necessary? And my answer to that is, no, it's not strictly necessary. But what would be interesting, and the line that we're pursuing, is what were the mechanisms that explain the decline in inequality post-lockdown versus pre-lockdown? And if there are different mechanisms operating, then you can say there's kind of a causal thing going on, though it's different, right? Yes, there's a trend, but there's a different reason for it post rather than pre. And I think it's important to think about that because at some point, knock on wood, the pandemic will end and we'll want to know what happened. So you really want to think about those mechanisms and whether the pre-pandemic mechanism is different than the post-pandemic mechanism and whether we can return to that pre-pandemic mechanism. And so I think that there is some possibility for that. I think right now the only evidence that we have that hints at it in this current paper is the business income effect. That's driven by national negative aggregate shock. Before the pandemic happened, the economy wasn't hurting. And so that probably wasn't the explanation. So at least there's some hint that there's a difference in mechanism. That was point one. Point two, Neelanjan raises a very important question. How much can you hurt the poor before it's too much? That is to say, let's suppose the poor only drop 20%, but the rich drop 40%. Maybe the poor can't handle 20%. That's a great point. And one quick test of this is to see, for example, did deaths among the poor spike when the poor experienced their biggest drops, which is the lockdown? And I think the answer to that is no. If you look at the excess death results that Sabarish and I have, excess deaths don't spike during the lockdown. They spike when there are a spike in cases, which is months after the lockdown. So it's September, October, and then again, Delta wave, which is the following year, March, April, May, something like that. And so I don't think that it is a travesty what happened to the poor during the lockdown, but I don't think it was enough to trigger mass deaths. And that I think is an important thing to consider. I think that the positive thing that I took away from this is that there is some consumption smoothing and thus some ability to have resilience amongst the poor even during the lockdown, although I do suspect that the exemption of agriculture was critical for that to work out. Okay, the last thing, I'd say the next thing I want to talk about is comparing rural to urban. And Neelanjan's right, there's a difference between the two and we need to explore a little bit more. I think the first thing that we're doing now is trying to plot how migration varied during this entire period. Was migration actually a source of a buffer? The only thing that my prior tells me is that I also remember seeing worries about the migration out right after the lockdown ended, the national lockdown ended, but 2 months later, people were like, oh, everybody's returning back to the cities. And I think that what really happened was there was a deflected rural agricultural migration was just kind of pushed back by the lockdown, and then people came back to the cities. So I'm not sure we see a massive difference there, but we will explore it more. I think it's worthwhile for us to explore the labor side of this in urban and rural, so we'll do that. The last comment I want to make is about maybe the rich were hurt less overall by the decline in income because they have they have more risk tolerance. And I think that's a very interesting thing, and we should certainly look at. I will point out that I think a lot of our intuitions about this are motivated by people that are in the 0.1%, and we're just not going to be looking at that in these data. And it's very important to do that. But normally, I would say I just don't think that that's important. I think it's important because, sadly or positively, we're probably towards the high end of the SES distribution, given where we are and what jobs we do, and we tend to interact with those individuals, but those are still relatively rare individuals. They're 0.1% of the population. I think that we shouldn't ignore what goes on with the rest of the population because we think that group may have done exceptionally well. They probably did a lot better than what happened to the 75th percentile. I think that that's a little bit more representative, but that's just me editorializing. But otherwise, I think you have a good point.
Thank you. That was wonderful.
Thank you, Anup. We have had about 26 questions from the audience, and Arpit has done a wonderful job parallelly answering all of them. So there are no outstanding questions right now. If the audiences would like to ask any questions, you're free to ask that. We are exactly on time. There are 3 minutes to go before we wind up this session. But Anup, it's been a wonderful paper, excellent. I was truly impressed with all the robustness checks that you did. I'm not an economist like Neelanjan keeps saying. I'm far from that, but I was very impressed with all the work that was presented over here. And Neelanjan, excellent points. And this was truly a wonderful session. If there's anything that you would like to say, or Arpit or Bartok would like to say before we wind this up, I'm happy to call this to an end. Before that, I'll announce the next session. But would you like to say anything, Arpit or Bartek?
I just want to thank everyone, in particular our discussant, for some excellent comments.
Okay, thank you.
Likewise, thank you very much for all the comments. Definitely enhance the work.
Okay, great. So the next CPR, look at this, Neelanjan, what happens when you're there on the show? I replace CPHS with CPR. So the next CPHS webinar is next Thursday, 10th of March, by Dr. Indradeep Ghosh from Dwara Research. And he will be presenting a paper digging into household savings from CPHS and connecting that with macroeconomic indicators. So it's a very different kind of a take, connecting micro data with macro indicators. And the discussant is going to be Saugata Bhattacharya from Axis Bank. He's the chief economist there, vice president. So we'll see something very different next time. But thank you once again to all the panelists and to all the participants who spent time today. There are 2 questions. Would you like to take that, Anup, Depojal Saha? And I'll answer this. If you don't mind, all the participants, we will make the questions and answers transcripts available on our website. So we will take care of that. The YouTube will be available, and so will the questions and answers, and so will the presentation. So I request Anup and Neelanjan to please send your slideshow to us. We'll make it available on our website. Okay, thank you very much.